are you doing today?
I'm doing good. How are you?
Pretty good.
That's good.
Yeah. So can you tell me a little bit about yourself?
So my name is Rebecca Deputy. I am a nursing student getting ready to graduate, planning on taking the NCLEX this summer. I have been going throughout nursing school. I've been getting all A's and B's. I've been very interested in healthcare ever since I was little. My whole family is actually a part of healthcare in some way or another. So I have like 4 aunts that are nurses. I have like 4 cousins that are nurses. My mom's a pharmacist. So I've been very exposed to the healthcare field ever since I was young.
Nice. So you kind of knew for a while.
Oh yeah, knew since 6th grade that I wanted to be a nurse.
Okay, so a while. What do you say some of your greatest strengths are that would help you as a nurse?
I'd say some of my greatest strengths are probably being really organized. I've always been organized ever since I was little. Like that's been a thing that's been drilled into me ever since I started to want to go into healthcare. I'm very task-oriented. I'm very good at completing all of my tasks on time. Very time management.
Good.
Yeah.
Great. Do you have any weaknesses that you think will come out in nursing?
Probably say I don't focus on myself enough, I guess. Like, when I'm at work, that's what I focus on most. Like, even outside of work, sometimes I'll be focused on work and not necessarily take time for myself.
Yeah, I feel like that's pretty common in nursing.
Yeah. Oh, yeah.
Have you ever had to experience a coworker or a patient or someone who was upset and you handled the situation well?
Yes. There was a time that I had a patient. She is bedbound, or was bedbound. She was very, very particular about how she wanted her care done, and if you did not get it right, she would be very mad at you. She would be yelling. So what I ended up having to do was, whenever she got mad, I'd just sit there and I'd have to listen. I'd have to wait for her to finish, otherwise she'd get more mad. And I'd have to talk to her and try to educate her about everything, and if that didn't work, most of the time she'd be calm enough by the end of it that we could just continue on. But if not, I would have had to go and get someone else to try to talk to her and get her to calm down.
Gotcha. So what was the result from that? Were you able to continue her care through the day?
Yeah. Most of the time, whenever we were caring for her, she did calm down relatively easy once she got her frustrations out.
Gotcha.
After I sat there and intentionally listened to everything that she was saying and acknowledged her, she calmed down a lot and allowed me to care for her.
Nice. Sounds like you had a couple people working together to help you with that too.
Yeah.
Are there any other times where you had to work as a team or where you had to contribute?
Yes. So on the floor that I've been going to for clinicals, we've definitely had to do a lot of teamwork. So each one of us would go through and help each other out whenever we were super busy or whenever we just were overbeared with work, I guess. Or if we were stuck in a room with a certain patient that had a lot that they needed done. We would be able to delegate and ask everybody else, like, whatever tasks needed to be completed right then and there, they were able to get it done, and I was able to help people whenever they were in the same situation.
Good. That sounds very nice. Have you ever had to be creative as, like, a student nurse or as a tech or anything?
Yes. So I would definitely say one of the times that I've definitely had to be the most creative was actually in my capstone. We had a 3-year-old patient that had come in. He was very upset. He was very disgruntled. We had to figure out a way to be able to get vitals and stuff on him. So we had somebody holding him, and we were trying to tell him, like, oh, like, the pulse ox is a sticker, like, so we could put it on his finger to get a pulse ox, and tell him that the blood pressure cuff was going to give his arm a hug, and all these other things, just to try to get the vitals on him, just so we could make sure that he was okay.
Okay. Very nice. Kids can be difficult to work with sometimes.
Oh, yes.
So why do you feel like you would be the right fit for this role?
So I believe I'd be the right fit for this role because I am, like I said, very task oriented. I know what I need to be doing. I'm a very good team player. I'm very good at coming in on time, doing everything on time, and probably say because, well, probably just because of all those things and being able to do everything that I'm asked of.
Okay. Do you have any questions for me?
Yes. So based on what it's shown on your website, how many, like, what's the patient to staff ratio, would you say, on a normal day?
I'd say on a normal day, we're like 4 patients to 1 nurse.
Okay. And then do you guys have mandatory overtime?
No.
No?
You
Okay.
can pick up if you want to, but you do not have to.
Okay. More of a uniform question. Do you have a certain uniform that I'm supposed to get before I start or when I start?
We have certain colors we wear, but we don't require that you wear like a scrub top. Like if you have a shirt that at least identifies you as a nurse or is part of the hospital, then you are welcome to wear that with the designated scrub pant color.
Okay. And then do you guys have any programs for new nurses coming on to like do training and stuff before they just start?
We do a couple weeks of orientation with just new nurses beforehand, and then you'll do your on-unit orientation, and you'll have a mentor through that, and someone who has a little bit of experience in the field but has recently gone through like the new grad transition, so they kind of understand what you're going through and support you through that process.
Okay. Thank you. I don't have any more questions.
Thank you. I
answered well.
appreciate your time.
Hello.
Hi.
How are you doing
Good,
today?
how are you?
I'm doing great. So first things first, I want you to tell me about yourself.
Yeah, so I'm Wyatt. I'm a senior at Ball State University, nursing student. I graduate here in May coming up. So I'm a senior nursing student at Ball State, and I graduate in May, and I will be actually having a minor in counseling as well. And so I have been in the nursing fields ever since my senior year. I had an internship in an ER, and I instantly fell in love with nursing, and I knew it was what I wanted to do right away. So I instantly decided I was going to come to Ball State and be a nursing major. And some more about me, just in my free time, I'm very active and hang out with my friends a lot, and I try and stay about as busy as possible.
That's good. Glad that you knew what you wanted to do right away.
Yeah.
A lot of people have some struggles doing that.
Mhm.
So next question is, what would you consider to be your greatest strength?
I would probably say that my greatest strength is my hardworking capabilities, and I'm just a very driven person. When I am at the job, and really all aspects of my life, if I'm doing something, I'm going to do it full force with kind of everything I have. And then another one is just being very on my feet, and I can do well in stressful situations and adapt very well.
That's a very good thing for nursing school and nursing in general. Yeah. So then, based on that, what would you consider to be your greatest weaknesses?
I would say my greatest weakness would be my inability to say no. There are a lot of times that I take on too much myself, and if people are asking things of me or for help, I'm very eager to say yes. A lot of people say I'm a yes person, and so it's very hard for me to say no in those situations. But one thing is I do know my limits, and I do know when it's too much or it's unsafe for a patient or unsafe for me to say yes, and I am good about saying no in those situations at least.
Yeah, that's very good that you know your limits with that. Yeah, that'll definitely be helpful. So the next question is, it can be frustrating when you're trying to get information from other people to solve a problem. Can you describe a situation that you had and what you needed to do to get the information that you needed?
Yeah, during my capstone, just with the hospital, there was a doctor that we had this patient that their condition was dropping, and it was kind of more an urgent thing. Their needs weren't being met by the doctor per se, and we could see that. And so we were trying to get answers and information for the doctor about half of the day, until eventually we decided, me and my nurse, that it would be best to just see if we could find a different doctor to take over that patient, who would be more adamant about focusing on the patient and their level of care. So we were able to get that switched, so they had a new doctor for their stay, and that all of their needs were taken care of, and we were able to get everything we needed.
That's good. I'm glad that you were able to find somebody that was going to help them.
Mm-hmm.
Yeah. So, can you think of a time when you had to work in a team situation? Can you describe how you felt about the contributions of other team members?
Yeah. I mean, I feel like I've had a lot of times where I've worked in a team effort, especially in the nursing field. I feel like you're always kind of working as a team. Just for the most part, I feel very appreciative of other people's contributions. I feel like a lot of times when I'm in these team situations, everyone else is very good at communicating, and I feel like I'm a very good also communicator and able to respond well in that situation. And I feel like a lot of the times everyone really knows their role very well and stays to that.
That's good. I'm glad to hear that.
Yeah.
Okay, so can you tell me about a time when you made a major sacrifice to achieve a work goal?
I wouldn't necessarily say it's a major sacrifice, but I'd say there are a lot of times that I go out of my way to either stay extra time over, or skip my lunch if it's just better for the patients that way. If it's a busy day and I have a lot going on and I'm just running around, usually I'll just kind of skip that lunch. Or there have been times that it's been a busy day, and when they're doing shift report, I don't really have much going on, so I'll stick around for an hour just to answer call lights while they're getting set up for the day.
Yeah, that's definitely very helpful, but
definitely a sacrifice as well.
Yeah, definitely
just
a sacrifice.
Missing out on life outside of work, but it's worth it. So.
Yeah, that's good. All right, and then last question is, why do you believe you'd be the right fit for this position?
I feel like I'm a very eager beginning nursing student, and I feel like I have a decent amount of experience in the clinical field, just through school and also an internship that I had, as well as my job is also a student nurse position. Mm-hmm. So I feel like I've had the experience. I just need to kind of get into that learning environment and really adapt my nursing skills, and I feel like this is the perfect place for it. I feel like you guys are very good about patient safety and focusing on the patient's needs specifically. So I feel like that's a core belief of mine, is advocating for the patient, and I think that I would fit in great here.
Yeah, that's good. I'm glad to hear that.
Thank you.
So do you have any questions for me then?
Do you know about any PTO or vacation time for this position?
So your PTO will not start until after you have orientation completed,
mm-hmm.
just so that while you're orientating,
mm-hmm.
That way you're able to get all of your work done, get all of your learning experiences before you actually start by yourself. But after that orientation period, you will start accumulating PTO.
Okay. And then just as far as next steps, is there like an email that I could reach out to you, or like any next steps that I need to be aware of for this?
Yes. So I'll actually be emailing you everything
mm-hmm.
afterwards.
Okay.
Probably about an hour or so.
Mm-hmm.
But yeah, once I email you, you have my email, my contact information, and any of the other information that you need before you start the position. Okay.
Okay. Awesome. Thank you so much.
Yeah. Thank you.
Hi there.
Hi, how are you?
Good, how are you?
I'm doing pretty good today.
Well, we'll start off. Can you tell me a bit about yourself?
Yeah, so my name's Samantha Crawford. I'm currently a senior nursing student at Ball State University. I guess I always knew I wanted to go into the medical field. I just thought it would look a little different from nursing. I really geared my path towards going to medical school. So nursing is actually my second degree. I started off in biology at a small college close to here and completed that. applied for medical school and did a semester of medical school and realized I did not like it as much as I thought I would. I realized I wanted to be hands-on at the bedside with the patient, and that's not necessarily what a doctor does, and I found that more in the nursing role. So I've been working as a student nurse tech at a local hospital in the ER and have loved every minute of it.
Yeah, awesome. It sounds like you know where you're at now, and
After
that
a
you're on the
couple of
right path.
years, yeah.
Yeah. Okay, so next question is, what do you consider to be your greatest strengths?
I would say one of my biggest ones is I'm very detail oriented, which I believe is super important for nursing. Just getting a whole look at the patient as a whole, what's going on, and just things that they're saying, and maybe not verbally saying, but also how they're reacting to situations, because that can influence how we act as well. And I'm also very willing to learn. Like, I want to be the best nurse I can, and I'm very receptive to people giving me suggestions or saying, hey, I do it this way. Why don't you try it like that? I like that, and I just want to be the best nurse I can.
Yeah, that's a great strength to have, and it's a great goal to have, to be the best nurse possible. So something we definitely look for here. But on the other side of that, what do you consider to be your areas of weakness?
I'd say my biggest one is I'm like super self-critical. There's a lot of hands-on skills you have to do in nursing, and it takes time to learn those. So for me, when I started doing some of those and didn't get it right the first time, or maybe not perfect the first time, I put that more on myself than like, hey, you need to learn.
Mm-hmm.
So I'd say that's one of my biggest weaknesses. And sometimes I struggle with like a good work-life balance. Especially with school, I'll go home and I'll just keep studying and not take a lot of time for myself. I am learning. I'm working through it, trying to find some hobbies that can help me with like stress reduction. But that's something I've struggled with school and life.
All right. And the next question is, please describe a situation in which you handled a difficult patient, and how did you manage that stressful situation?
Okay. So in the ER at the hospital I work at, we have a nursing home, like right across the street. So we see a lot of those patients. And this one in particular, the patient had dementia really bad and just didn't really trust us working with them. Wouldn't stay in bed for us, was just very complicated. We already had him by the nurse's station. We had his curtain open watching him, but we just couldn't get him to do anything. And we really didn't want to put restraints on him. And he didn't have family with him at the time. So we really contacted family, tried to figure out some things that we could do and work with him on that he would enjoy doing that was maybe not related to why he was at the hospital. So it came out that he liked coloring. So we got him some coloring pages and crayons that we had, and me and one of the other techs and a paramedic would rotate through, sitting with him, coloring, not necessarily talking because he didn't like that. And that really calmed him down until family got there, and he trusted his family member. So going forward, we would kind of talk to both of them at the same time, and the family member would relay the information to him, and it made the situation much better with just that simple fix.
Definitely families can be beneficial in care.
Yes.
I know there are definitely downsides to it as well,
Yeah.
and families can be an issue, but family involvement is a good thing to have, and good to use and utilize when you can.
Yeah, I agree.
So can you tell me about a time when you had to rely on a team to get tasks accomplished?
Yeah, so, going back to my work, we see a lot of patients that require multiple nurses or multiple medical professionals to be in the room at the same time. And we had a patient that was coming in actively having a heart attack. And rather than just going in and kind of not really knowing our exact roles, we assigned each person a role before going into the room. So one would do the EKG, one gave meds, one took the triage information. And it just made the situation go super smoothly. So I couldn't give meds, so I did vitals and helped with the EKG. And we got him to the cath lab, probably the fastest I've ever seen it. Get someone down there, it was less than 35 minutes, so pretty quick. And we know it's important to be pretty prompt when we have situations like that. So working as a team definitely benefited us and the patient in that situation.
Yeah, especially in emergent situations, teamwork is almost critical.
Oh, most definitely.
Just to save time and be efficient in care. So
yeah.
Can you tell me about a time when you were very effective in your problem-solving ability?
Yeah, we had another patient come in, and we had seen him before, had cut himself, and was on blood thinners, so he just really would not stop bleeding. He had already had stitches once, so we were kind of surprised when he came back in and was bleeding again. And the doctor was like, we need to figure out how to stop this bleeding. The pressure wasn't working, so we had to figure out how to get his arm above his heart, and we didn't have anything that could like hold him up like this. So we came up with using a IV pump pole, and then we would wrap a towel around it to make it kind of soft, and then we taped the patient's arm up like this because the cut was up here. So to get it above his heart, and it was still like somewhat comfortable for him, he could relax his arm and not just hold it up. And I'm sure we got looks. I know our doctor laughed when he walked in the room, but he was happy with the outcome. But it was just situations like that where we kind of had to work with what we had to figure out what to do for this patient.
Yeah, especially in emergency care, that's probably pretty common, is just having to be problem solving and figure out situations like that.
Yeah,
so,
kind of working on your feet as you go.
Yeah. And then the last question I have for you is, why do you believe you would be the right person for this position?
I feel like for this position, I could really benefit the department just because of my background, having multiple different educations, and the biology helped me understand like cellularly, like how things work, why they work, and now with nursing, I can see like how to implement those. So I think working or using those both could benefit not only me at providing better care, but also explaining to my patient what's going on, because that can be very stressful for them. And I'm just very willing to learn. Like I said before, I want to be a good nurse. I want to provide the best care for my patients, and I will do that in any way I can.
Yeah. From what I can tell, it does seem like you would make a good fit in this position. Do you have any more questions for me as of now?
Yeah, how do you guys have like a weekend rotation, or are weekends required?
Yeah, so we do every third weekend is required.
Okay.
So we do have enough staff that we don't have to do every other weekend,
Okay.
but every third weekend is required, and then you can obviously pick up. There is weekend differential as well.
Okay.
So.
Awesome. And then just kind of like the work environment, do you feel like the doctors respect the nurses and respect their opinion and what they think is going on with a patient when they make suggestions?
I definitely think so. I think we are a place that relies on nurses' voice, and it goes a long way in the doctor's mind. There are obviously those outliers, I would say. Everyone has complaints every now and then, but we are very good about addressing those early on and kind of breaking down that barrier.
Okay, perfect. I think those were all the questions I had.
Awesome. Thank you.
Thank you.